A new clinical trial shows a wearable patch could prevent severe allergic reactions in toddlers with peanut allergies.
Our medical expert, Dr. Kohli, is joining us now to talk all about it. Thank you so much for joining us, Dr. Kohli.
Good morning, guys. This is groundbreaking.
It really is.
Yeah.
It's a game changer. So how common are peanut allergies in the U.S.? Because we were just talking about how we've seen society change and adapt to other people's allergies.
They are so common, and the prevalence is actually increasing. So 1 out of every 50 kids is going to have a peanut allergy. And what we've seen in the last 20 years is that number is actually going up. Now, we don't understand why it's going up. And we also know that although some kids will outgrow them, about 20% will outgrow them as they grow up, for some it actually gets worse as they get older.
And that's really scary. Like some of these kids, like you were just talking about, they can't even have a dusting in the air of this, and it's deathly. They need an EpiPen nearby. So talk to us about some of the current treatments aside from the patch that people are doing now.
And that's the thing, we don't have a lot of good treatments. So the FDA has nothing approved for kids under the age of 4. And for 4 to 17, they have this kind of protein powder where you can mix it into applesauce, yogurt, or something else and kind of use what's called oral immunotherapy. So you're introducing the peanut antigen little by little to train the immune system not to react to it. But nothing under the age of 4, and the reason it's more important to actually train your immune system when you're younger is because it changes the reaction of the immune system a little more efficiently. So when you have a young, naive immune system, it learns things better, so it learns that tolerance a little bit better. The other piece of this is using a patch rather than using something oral. The doses are magnitudes different. So in a patch, you see microgram doses, teeny tiny amounts. You don't need to use a lot. Whereas in oral therapy, you sometimes see milligram doses, which is several-fold more doses, and so that people can have more reactions.
Okay, so walk us through how this patch works.
Yeah, so it's really cool. It's a little square patch, and you put it in between your shoulder blades for kids, or really anywhere on the skin. And the longer you wear it, the more dose of peanut protein you get exposed to. And what they did is they actually tested it in kids 1 to 3, so tiny little kids who had peanut allergy established. Now, the threshold for peanut allergy was different for each child, but it didn't matter where you started, because no matter what your threshold was for triggering the allergy, the patch worn for 22 hours a day over the course of a whole year made 2 out of 3 kids less reactive. And so it reduced that threshold, and it reduced the severity of the reactions for the kids that still had them.
I mean, that's so significant when you think about it. It's really cool. Were there any major red flag side effects?
So, out of over 300 and something kids that wore the patch, 4 of them had anaphylaxis. Now, we're not talking about life-threatening anaphylaxis. We're talking about what we call mild to moderate anaphylaxis, and 3 of them required an EpiPen. The patch was irritating to most kids.
Okay.
So even the ones that wore the peanut patch and even the ones that wore the placebo patch, they had skin reactions, a majority of kids. So that is a consideration, obviously, because allergies and eczema, which is, immune response in the skin, those sort of travel together. So certainly that's something we'll have to think about. But, you could tolerate exposure to 1 to 3 peanuts by the end of it.
It's amazing.
Which, when we talk about how we travel on a plane or anything else, we're afraid to even have a little dusting of peanut. And now you're talking about potentially being exposed to a whole peanut.
Think about the parents who have had to rearrange snack time for their kids at school because of that, because we're considering every student, right? Which is wonderful. You call this a breakthrough technology. Do you see this shaping medicine moving forward for other allergies as well, too?
I do, and I think that this is a bit of a wake-up call for us because the incidence and prevalence of allergies is going up. We need to do better. We need to understand how the immune system gets mistrained so that we can sort of retrain it early, and we need to start doing it when kids are little so that they don't have to deal with it. Because as you pointed out, Jordan, I mean, the psychosocial impacts of having food allergies, not just on the child, but also on people around them, the fear, the worry, the anxiety, it's really tremendous. And we may not be able to cure the child of allergies. They can't eat a whole peanut butter and jelly sandwich. But if they got exposed to something, or if they were eating something that was manufactured at a facility where they processed peanuts or what have you, parents could breathe a sigh of relief. They don't always have to have that EpiPen.
We're not scared of them losing their life or something like that. This is awesome.
And you talked about the exposure really quickly too. Like, for example, I'm deathly allergic to bees, but I was stung 3 times over the years, and it wasn't until that 3rd one that I had that reaction. So that's why you say it's so important to expose the kids earlier to these, just to build up their immunity.
That's exactly right, and I'm glad you brought that up because sometimes people say, well, they've had eggs before, so they can't possibly be allergic. It's not the first time. The first time sometimes just sort of tickles the immune system and tells it that it's something foreign, and it's that second exposure sometimes that can cause that sensitization. So you really do have to have your radar up, and you have to be watching even if someone's had something that they've tolerated before, whether it could be related.
Pay very close attention to your body. All right, Dr. Kohli, thank you. Let's